look and feel younger, but that pursuit for the fountain of youth, it's not limited just to the outside of our bodies. Check it out.
So I'm here in Dr. Weiss's office. I've been struggling with stress urinary incontinence and vaginal dryness, vaginal irritation, urinary frequency and urgency, and I'm done with it. I'm over it. And I'm so excited about this new procedure that can help me. And I was also told that it helps tighten things up a little bit too. Hi!
All right, Jen, you ready to do this?
You're my favorite guy.
Don't be nervous.
I'm nervous.
I watched a YouTube on how to do it, so we're okay. So what the MonaLisa does is a CO2 fractionated laser treats women who have atrophic vaginitis, so in menopause, the thinning out the dryness of the cells.
I'm not in menopause yet.
Right.
Just to be clear.
Yeah. So what we're finding now, it does increase blood flow. There's angiogenesis. New blood flow grows into the tissue.
Really? So it'll be juicier and youthful and...
You explain it so much better than I do. All right, I'm going to get you set up.
Okay.
And we'll go do our laser. This is the probe. It has markers along the side of each centimeter. We put the probe in, and it shoots the laser. We can't use any lubricant when we put the probe in because it's a CO2 laser, and it has what we call affinity, as you know, to water. So we're going to put the probe in.
You have to relax.
You're done.
Oh my gosh, I survived.
You did great. You did great.
From that procedure with Dr. Berman, Dr. Peter Weiss joins us. When you do a procedure like this, what are the main things you're looking to improve or treat?
A great question, and that's a really important thing. So it's a beautiful video, it makes fun, and it makes light of a real medical condition. So when we talk about menopause, in men we have so many other avenues that we can deal for sexual function. Women who go into menopause, and this was really geared back in Italy about 3-4 years ago for women who've had breast cancer who could not take estrogen. So the woman's vagina becomes very thin in menopause, or if you have breast cancer, you can't take estrogen to treat it. So the laser stimulates, goes down into the real meat of the area where it'll have new cells grow, new blood flow. Really what the MonaLisa touch laser is, a CO2 fractional laser. And
right, which I use on the face
all the time.
Yes.
This is a specific type of probe that's FDA approved for the vaginal tissue. It's something called the decapulse. I can go all the science, but it's really geared to reinvigorate and stimulate the growth of healthy tissue in women, primarily who've gone into menopause, who have the thinning of the tissue, becomes pain with intercourse. That's where it works. And in my practice, we're finding about 90% improvement with it.
And obviously, Dr. Berman, you have access to a lot of therapies, technologies, Dr. Weiss. So as far as anyone watching at home, how much does it cost as far as...
Another very good question. So when women go into menopause, after about 4 years of menopause, about 60% of women will have complaints such as this with the dry vaginal tissue, pain with intercourse, bladder function, things like that. So it really does affect a great number of women just going through menopause itself, and then you have other women who have issues from breast cancer and
so
other bladder issues. The cost varies. Insurance doesn't cover it. It depends on what... Well, it may or may not, but bottom line is between $500 to $1,000 of treatment. You need 3 treatments, 6 weeks apart, and then you get 1 year's, and then you're fine. And then every year you do a maintenance. So that's really what it really gears, and we have phenomenal response.
You want to know how I'm doing?
Just a couple days, how are you doing?
Well, I do notice more vaginal, I mean, not to be lewd, but more youthful, like when I was younger, kind of secretions going on.
That's a very common response. And what happens, like you know from when you do the CO2 laser of the face, the cells start to grow. So you see a response within about 2 weeks, and that's for the initial treatment. And the reason you do 3 treatments is because the cells will start to sort of die off again. So once you do those 3 treatments, you get about a 1 year.
But I'm having actually no frequency and urgency. I will say, frequency, which I have all the time, frequency urgency is gone, 0.
Wow.
I don't think I've even gone to bed.
Well, and what is so great about this technology, and lasers are improving, it seems weekly, is so many more options for, you don't like the word rejuvenation, but it's non-surgical, and so it's so much more benign in terms of some of the other things that may have to be done. So I think this is a great option, and Dr. Weiss, thanks so much for sharing this technology with us.